So we've got a subscriber asking us about a maxillary sinus lift procedure. So his question is, what is sinus lift? Please explain. So let's look at sinus lift in this particular video. Hello, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja Annamalaipuram since year 2001. If you have not yet subscribed to our channel Pearls Dentistry, please do subscribe. We've got a whole bunch of videos coming out on dental awareness and education. So when it comes to replacing teeth with dental implants, especially in the upper arch, sometimes you're faced with a situation where there is not enough bone for us to place implants. So why does this happen? So now let's understand this. Our upper jaw bone is called the maxilla. So the maxilla, we have got a pair of maxilla, the left and the right. Inside the maxilla, there is an air-filled sac called the maxillary sinus. So sometimes we have patients complaining of sinusitis, some inflammation, pain in the jaw region. It's happened because when there's an inflammatory process that is happening inside our sinus. So the sinus is a normal feature in our upper jaw bone. It increases over a period of time. So it's mostly present in the maxillary posterior teeth, that is premolar molar region, especially in the molar region. Over a period of time, as we advance in age, the sinus can increase in size and becomes pneumatized. What it means by pneumatized is it's an air-filled sac. It can become bigger in size. So as the sinus enlarges, the bone that is available below the sinus reduces. So especially when patients who have lost their back teeth, posterior teeth with advancing age, it has been found that the sinus largely pneumatizes and the amount of bone that is available for us to place the implant in the posterior maxillar region is limited by the presence of the sinus. But say we want to do implants, the patient has got all the upper front teeth intact, they are in great health, so it doesn't require any removal. So we have to replace only the back teeth. So then what we do is typically we do a procedure called a sinus lift procedure. Very safe, very predictable, is being done for many decades now with a very good success rate. Of course, we need to follow certain precautions, certain principles when we do the sinus lift surgery. In this particular procedure, what we basically do is the sinus is lined with a membrane, right? So this membrane is what that limits the sinus to the surrounding bone. So during sinus lift surgery, what we do is in our upper jaw, the posterior region, this membrane is lifted up. So what happens when the membrane is lifted up? There is a space that is created between the membrane and the underlying bone. In this space, we fill it with bone graft. So what is bone graft? Bone graft acts as a scaffold which helps us, our own body, to form our own natural bone over a period of time. So when you lift the sinus membrane up, creating a space between the membrane and the underlying bone, fill it with bone graft, then there is space for us to place an implant there. So this implant can be placed either at the same time or as a separate procedure. So there are of course many ways to do a sinus lift surgery. So hope this video you're able to understand what a sinus lift is. And if there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun signing off from Pearls Dentistry. Bye bye and thank you.